when it's time to heal and feel, be real. You just gotta take your time, unwind and chill. Cause now it's time to love yourself. Build emotional and mental health. Cause Black woman, it's time to heal and feel, be real.
Hey y'all, we are back with another episode of Black Woman Healing Podcast. And before we jump into all the things and have all the conversations, we first want to welcome on our guest, Dr. Karen. We're trying something a little bit different, and we want our guests to share more about who they are so we don't miss anything. So, Dr. Karen, I'll hand it over to you to introduce yourself.
Thank you so much. I'm Dr. Karen Sheffield, a doula. I am a nurse midwife of 20 years. I'm a mother of 4. I have a 28-year-old, a 25-year-old, a 23-year-old, and a 14-year-old. The first was delivered by a physician, the second delivered by a nurse midwife, the third was an unplanned home birth. And the fourth is my bonus daughter through my second marriage. And I am a researcher at UNC Chapel Hill School of Nursing, and want to just make sure that I elevate and highlight that the majority of what I'll be speaking to you about today are my views and my views alone and do not represent the university. And I am a mindfulness instructor trained through Brown University's Mindfulness Center in mindfulness-based stress reduction. So I love all things women's health, mental health, and integrative health approaches like mindfulness.
All very important things, especially for us as Black women to be discussing. But before we even jump into all those things, and both me and Donika, and I'm sure y'all can relate to, Donika, you got an icebreaker for us?
Yeah, absolutely. We're rebranding, we're trying out some new things. And so I was going to do one of the Reddit questions, but let's try out we're going to have a whole new segment of a podcast.
Ooh,
So let's try it out. Let's see how it goes.
let's try it.
Dr. Karen, I feel like you're the right person to try it with us. So,
Okay. All right. Let's
okay.
do it.
So our new segment is going to be things Black women don't say out loud. And so we're just, gonna share and just discuss anything popping out for you, Myra. There's things that Black women don't say out loud.
Like, the holidays is coming up for me as far as like the cooking part of it all. Like,
Mm.
I feel like Black women don't say out loud, like, I don't want to cook excuse my language, all the shit for the damn holidays. Like, I don't want to cook everything. I don't even want to have the expectation that I have to cook anything at all. So I think that's what's like coming up for me. What about you?
I agree. I didn't cook for Thanksgiving, and for Christmas, I told my friend whose home I'm going over, I'm only making one thing. I usually try to make two. I'm only making one thing. I really don't, and that's if I'm saying it out loud. I don't want to cook at all. If I'm being really honest.
Yeah.
But I also am trying to save my coins because at first I was like, I'm gonna buy
That's
something, but I gotta save my coins, so I need to cook at least one thing. But
mm.
I don't wanna cook. I don't wanna cook.
Waiting for the day where we can just show up and everything is just catered. Like, but I also don't want to plan that. I'm the planner person. I just want to show up and everything is just catered and we just relax and somebody else cleans it, they
Mm.
prepare it, they do all the things. I'm waiting for that day.
What you
Yeah,
think?
I would love a chef.
A chef.
Yeah.
Yeah.
A chef. Yes, I would love a chef. But I think that what's jumping out for me in terms of the things that Black women don't say out loud really pertain to mental health.
Mm.
So we've got a lot of things that are going on for us professionally, personally. Life is life and things are going on, but we don't necessarily say that we are having a moment out loud,
Mm.
or definitely don't do it as often as we should. And one of the things that one of the participants in my research study said to me the other day was, just because I might look all right doesn't mean that I'm not struggling.
Mm.
Right. So a lot of times, many of us go around trying to look like we have it all together. And we don't have it all together. Or we say, check on certain people. I think we need to be checking on everybody because the last 5 years, 5 months, 5 weeks, 5 days have been stressful, have been traumatic, has been a lot. And we're going through it. So it probably does not surprise you that the person that studies and really emphasizes the importance of mental health is bringing up a mental health issue, but I think that's one of the big things. I could get into some women's health stuff too, but that's not this podcast, but I could talk a whole lot about stuff women's health related that Black women don't say out loud that we need to be saying out loud. And
Yes.
I love to say the quiet part out loud because I'm a midwife, so I can have those conversations and be completely comfortable in uncomfortable conversations and navigate that.
Totally, yeah. And it's making me want to remind y'all to go back and listen to our episode with Dr. Angela Barnett. She is the author of Soothe Your Nerves, which studies anxiety and depression around Black women. She is amazing. Go back and listen to that episode. She shares so much knowledge there, which I think takes a deeper dive into everything that Dr. Karen just said. So please go back and listen to that. Donika, please put that in the show notes.
That's fire. Yeah, I've heard that was a good one. Soothing the
So
nerve,
good.
which is really just, anxiety a lot of times instead of, many times we're not saying that we're anxious or we are experiencing anxiety. We just say, oh, my nerves is bad. That's what that was. I remember.
That's exactly right. Or I can't sleep, or I have a headache, or people, agitating me, or I'm irritable, right? But we're not saying I'm anxious.
Yeah.
Very
Ooh,
I do have one more thing
man.
I want to talk about within this.
Yeah.
So okay, because I'm like, okay, if nobody cooks though, then our traditions, our good food recipes, they don't pass along. So we kind of some like we do need to cook, but this is what I thought of. Okay, check this out. How about you cook when you want to cook? Like when
Like
you
the
have
same way that you cook me the red beans and rice.
when I have well, that was I did, yeah. I had some energy. So I feel
Yeah.
like, okay, cook those meals, have those recipes, carry on those traditions, but it doesn't have to be on those days. Let's say you're having a great week and you're like, I got some extra energy. I'm gonna make a dinner and then I'm gonna invite some people over. And if y'all come, y'all get to enjoy the food. I get to still make the recipes and do the things. And that could be something too. Yeah.
Absolutely. Do what serves you, right? I mean, I think that's the other piece. We've got to get out of doing things that no longer serve us, right? Do what serves you. Do what feels right in this moment. The mindfulness part of me is saying, do what is going to soothe your nervous system, right? We're walking
Exactly.
around just all stressed and tight all the time with dysregulated nervous systems. I don't believe that our nervous systems were ever meant to deal with this amount of traumatic stress cumulatively over time for the length of time that we have been managing it. Right. So if cooking a
Yep.
meal is what's actually feeling like it's what you want to do in that moment, go ahead and cook your meal. Because I agree. There's a lot of traditions that I haven't carried on. My mother passed away, and so there are things that I think about, "Oh, I wish I would have done," you know what I mean? Or I wish I would have gotten in the kitchen with her, so that I know how to do these particular things. So anyway, all that to say that yes, do the things that serve you.
Yes, especially with the conversation we're about to have, I think it's important that y'all hold on to that theme. I'm going to go ahead and jump in because today we're going to be talking about mental wellness tools that help in the postpartum period. But before we even jump in, I hear this used wrong all the time. So I'm going to hand it off to Dr. Karen. Can you define for us postpartum, the period versus postpartum depression?
Very different. They're very
Thank you.
different. So I appreciate the question. Postpartum period is from the time that you have the baby up until 1 year postpartum. That's the postpartum period.
Mm.
Sometimes you'll hear people talk about the perinatal period. The perinatal period is during pregnancy and up to 1 year postpartum. Postpartum depression is a mood state or a mood disorder, right? So that is very different and it can be associated with persistent sadness or not feeling like yourself or empty or hopeless, frequent crying, feeling overwhelmed, loss of interest and pleasure in things that you once enjoyed, fatigue, low energy beyond typical newborn exhaustion, difficulty bonding with the baby, not feeling like taking care of yourself, not feeling like taking care of the baby, feeling guilt or shame or feeling like you're a bad person. Postpartum depression can also be associated with anxiety. So a lot of times people think that they're completely separate. They often go together, but it's important to recognize that not everybody who's anxious is depressed.
Mm.
While oftentimes many people who are depressed can be anxious, not everybody who is anxious is depressed. So it's really important for us to have conversations about depression and anxiety separately because they can be separate, but they can also go together. We also think about with postpartum depression thoughts of harming yourself, feeling like others would be better off without you. This can begin anytime in the first year. A lot of times we think about or we hear people talk about, "Oh, you got the blues. You got the postpartum blues." That's
Mm,
typically in the first couple of weeks
mhm,
that we think about the blues. For postpartum depression, it's persisting for longer, right? And it can show up week 3 or 4, but can show up at any time in that first year in the postpartum period. So that's why it's postpartum depression, postpartum, post-baby, post-pregnancy, and then up to 1 year, period of time.
Thank you for breaking that down. I'm curious about the length of time that it can span. Because I've heard people be like, my child is 4, and I feel like I still have postpartum
Yeah.
depression. And I've never really looked into that. So I'm curious your thoughts on that.
Yeah, it's probably shifted more into just depression at that point. Not it was
Okay.
precipitated or started as a postpartum depression, but now has, transitioned into a full bona fide depression. And it's also important to me, not to just think about the diagnosis of postpartum depression or the diagnosis of anxiety, but thinking about symptoms. So if
Mm,
somebody just has symptoms of anxiety or symptoms of depression, that's just as important to address. Even if it doesn't meet some criteria or they've taken a questionnaire and they've checked off the boxes, even if it doesn't check off all the boxes, if it checks off some of them, it's still important to address,
for
Absolutely.
sure.
right? And the other thing that I think is really important is that you're at higher likelihood of developing a postpartum depression or a postpartum anxiety if you have a history of depression or anxiety. So it's more likely that you will experience that in the postpartum period. So wanting to make sure that we emphasize we are not counseling our pregnant patients, our pregnant clients. I'm speaking as a nurse midwife to my fellow clinicians off of their medications during pregnancy. There are very few medications that cannot be taken during pregnancy that are psych medications.
Mm.
If you don't have mental health, you don't have physical health.
Mm,
We want us to have our mental health. If mom is not doing well mentally, it will absolutely impact her physically.
for sure.
So
Yes.
there's a quote that says you can't have mental health without physical health, or you can't have physical health without mental health. They're connected, and that's a quote by Dr. David Satcher, former U.S. Surgeon General. So really thinking about how those two things go hand in hand, and the importance of if somebody is already on their medication, we've got to have a really good reason to take them off a psych medication during pregnancy. But I see that happen a lot, so that's why I want to make sure that I emphasize that. Also, a lot of times pregnant individuals feel like worried about taking medication during pregnancy. Just they're worried that there's going to be something like a consequence for the baby if they take their medications. And what I would say is there's a big consequence if you don't take your medications and you relapse. So we really want you to be well controlled and on your medications during pregnancy. And the other reason why there's so much confusion is that oftentimes their mental health care provider or their psych provider will say, "Oh, you're pregnant. You got to go to OB."
Mm.
Mm,
Say, it's a psych issue, you gotta go back to psych, and so neither one wants to really take care of that patient, right? And so we're wanting to make sure that we get people hooked in with the services that they need during pregnancy and postpartum.
Yeah, I'm that right there because I haven't birthed a child and I don't have that experience, but even just hearing about folks who are pregnant, it's like they always say you can't take any medicine. The only thing I think is like maybe Tylenol. I think that's the one like, oh, you could take Tylenol, but like nothing else. So it's so interesting hearing you say that no, and you said there's not even a lot of like psychotropic medication that will impact the pregnancy.
That's right, that's right, and I would say that I don't wanna get, too far into which exact medications because it's gonna be on a case-by-case individual, um basis. But what I will say is that is very true. There are very few psych medications, mental health medications that you cannot take during pregnancy. So I want us, especially for pregnant individuals, to take some of that stress off of them in terms of thinking about, oh, but how's it going to affect the baby? Let a therapist, let a psychiatrist, let a psychologist, let a licensed clinical social worker, let the mental health care providers worry about that for you. and tell you about the risks so that you can feel informed about your decision. And it's what we call shared decision making. So you understand these are what the risks are, these are what the benefits are. What would you like to do? So,
You're bringing up something for me because I have white clients, but I have very few. The majority of my clients are black women. I've heard that they are safe for my white woman clients because they have these conversations with their psych, but I've heard totally different from my black woman clients. And it's very sad because why are we being misinformed in this way? But I'm thankful that my white woman clients are teaching me this because then I can go back to my black clients and say, that's actually not true. We need to be talking to someone else. But again, it's my brain. Anytime I'm thinking about health when it comes to Black moms, me being a Black mom myself, we are treated so differently. Like, even in this, something that is so important to have information on, but people probably are not even aware of. It's so sad. So
yeah,
sad.
there are a very different lived experiences that Black women
Yeah.
are having during pregnancy and postpartum. Very different for lots of different reasons. But I think one of them is having very real conversations with our healthcare providers surrounding our mental health. So there's a lot of reasons why Black women may or may not be having them, but what I will say, postpartum depression, 1 in 7 women will experience postpartum depression, right? So that's significant. And as we think about maternal mental health conditions or disorders, about 20% of the population will experience one, which is 1 in 5. So it's more common than we actually think about. And it's more common in Black women. And Black women are less likely to seek treatment and receive treatment. We are underassessed and it's underaddressed for us. And so there are multiple reasons for that. There's mistrust and distrust of the healthcare system. I'm not going to tell you my business. You tell me if I tell you my business, you're going to involve CPS, and they're going to come take my baby when it's time for me to deliver because I had a vulnerable moment to share with you, right? So that's one of the reasons, the distrust within the healthcare system. And that's based on the history. That's based on the historical record. So when we go back and we think about Henrietta Lacks,
Mm.
Tuskegee Airmen, eugenics, J. Marion Sims, if we go back and look at the history in this country of what has happened for Black communities, especially Black women, there is a reason why we mistrust the medical system, right?
Mhm.
And so we are hesitant to share. But there is also something else that I talk about. There's a conceptual framework that I utilize in my work called Superwoman Schema. And Superwoman Schema is developed by Dr. Cheryl Woods Giscombe, who was my dissertation chair, a colleague, a mentor, a friend. And it basically states that there are certain socio-historical and cultural events that have happened in this country at the intersection of race and gender that have caused many Black women, not all Black women, but many Black women to take on 5 hallmark characteristics. They are emotional suppression, stoic exterior, determination to succeed despite limited resources, resistance to being vulnerable, and helping others even at the detriment of our own health. And
Mm.
so when we think about that, if we're emotionally suppressing, if we have a stoic exterior, if we're resisting being vulnerable, we may be less likely to talk about our mental health with our healthcare providers. So we're not even navigating it. However, I will also say many healthcare providers, especially white healthcare providers, don't know how to navigate the conversation surrounding mental health and stress with Black individuals. I go across the country and do grand rounds with my physician colleagues to talk to them about these issues. And I hear, so what should we be saying? Like, what is the question we should be asking? How should we be navigating this conversation? Right. And so if they don't know how to have the conversation's not happening, but it's happening with the white patients
Yeah.
because
Yep.
they feel more comfortable doing that, right?
Yep.
So I would say that that's part of maybe why you're seeing that difference in care or difference in knowledge
Mhm.
for your white patients versus your black patients.
Mhm.
Yeah. Wow.
Oof.
I know. I mean, ooh, yeah, so many different things we can dive into even more there, but definitely hearing you on the awareness and even this, like you being able to talk about this on the podcast and we're getting to make sure that we share this information so that we can help the next folks advocate for themselves. Even if hopefully some doctors are listening too. So, so they can ask the right questions.
Right.
But yeah, no, that's
And the right question
oh
is there anything that I need to know about you that's going to help me take the best care of you to get you to the best?
Mm,
I don't think I've ever heard that question.
me
Ooh.
neither.
So that's what I like to ask my patients. Is there anything I need to know
Wow.
about you that's going to help me take better care of you? What would you like me to know? Now, I can have my list of questions, right? I have to take a history, right? I have to know about your medical history, your surgical history, your family's history, your medications, allergies, all that. But also, I think to think about the person holistically and to put the ball in their court so that they know they're the expert in their own health, right? They're running this. Tell me what I need to know in order to be able to take the best care of you so that you can have the best outcome, right? I don't want to give you information that you don't care about. I want to know, as I've found in my studies when I've asked them, when I've asked Black women, um, what are you stressed about? And how do you want healthcare providers to ask that? They'll say, if you want to know what I'm stressed about, ask me what I'm Googling.
Mm.
Don't ask me what I'm stressed about. If we look at any one of our search histories at this point in time, we will know what's on our mind. I will know what's on your mind, Myra. I will know what's on your mind, Donika. Like, I will know, right? You'll know what's on my mind. If Black women during pregnancy are Googling about their outcomes, oh, they stressed. They're 3 to 4 times more likely to die due to a pregnancy-related cause, right? They're at risk for twice the rate of preterm birth and low birth weight. They're at increased risk for hemorrhaging, increased risk for preeclampsia, right? So if you start reading all of that, now you're like, oh, you know what I mean? Like, very stressed about that. So that's a beautiful moment to have a conversation about, well, let's talk about the statistics of this and let's talk about what we can do to ensure to the best of our ability that we're taking care of you in a way such that that outcome doesn't happen for you. And first of all, it comes by listening. When a Black woman says something ain't right, I'm listening because what it took for her to say something isn't right. From the time she left her house to the time she got to the doctor's office, she tried to talk herself out of it 10 different ways. My headache isn't really that bad. Or, no, I probably felt the baby move. Or, oh, no, I don't really think that this is a problem. And they don't want to bring it up. So if they say something doesn't feel right, I'm listening because more times than not, something's not right.
Yeah. Oh my goodness. Yeah. Thank you so much for, hearing us and encouraging folks to listen. Um, you talked about like Google, like you said, this piece of like, what are we Googling, which made me think of like social media and how nowadays we do have social media, um, which I think plays a part in everything as well. But do you think there's an increase in postpartum depression in our present day?
There is an increase in postpartum depression over the past decade. We have seen that there has been an increase in postpartum depression. So it used to be closer to more like 10%, and now it's higher. So, but we don't know exactly why. We can speculate why it is. It might be that we're a little bit better at screening and getting answers to that. It might be that people are more vocal about it, right? I didn't say it was necessarily a lot higher in Black women, although I believe it is. And I think that's more related to what we call social drivers of health or social determinants of health. Things like things that are stressful, racism, bias, discrimination, institutional racism, structural racism, the way that we're treated, the way we're not listened to, the way that our pain is dismissed. There have been studies that show that healthcare providers believe that the Black women or Black individuals do not feel pain in the same way that white individuals do. And that is not true. There is nothing inherent about the amount of melanin in my skin that makes me not feel pain in the same way that my white counterparts do. So really wanting to make sure that that's elevated, but you wouldn't believe how many people still have that false thought, right? So yes, postpartum depression is more prevalent than it was 10 years ago. Um, I don't know how much it's related to our screeners that are out there. So when I say screeners, I mean like surveys and questionnaires that we ask, like the Edinburgh Postnatal Depression Scale or a PHQ-9 or a GAD-7. These are different generalized anxiety disorder scale. These are different scales that we can administer, but I don't think traditionally those scales are culturally relevant. So I think when we administer these scales to Black and brown people, we're not picking up on their anxiety or their depression because it's not the way they talk about it.
Mm.
So we need more culturally relevant screeners to be able to think about it in that population. And until we have that, we need to be having conversations. Right? And so the screener was always meant to just be that, a screener. It wasn't meant to be diagnostic. It's meant to be a point at which you now have a further conversation. I see you answered this way on this survey or this questionnaire. Can I talk to you a little bit more about, is it okay if we have a deeper conversation here? Now I know a lot of healthcare providers don't have the time, right? Especially my physician colleagues, they have 10 minutes to see a patient in and out. But my nurse midwifery colleagues certainly have longer. Um, and I would just encourage people that this needs to be a priority. People's mental health absolutely needs to be a priority, especially in this current climate.
Yep.
Life is life, and y'all, and stress is real.
Yep.
Stress is real, and so we need to be addressing that.
Yes, Dr. Karen, you're making me think about my doctor who every time I go to her, she was known for being really slow because she didn't care that her appointment was supposed to be 10 minutes. She'll say to spend an hour with you. You be in the waiting room pissed off because you like, I wanted my appointment. And so it was like this ongoing joke where her nurses would be like, she was talking a whole lot. But one thing I can say I appreciate about her is if I told her one thing, but I said something else in one of these surveys and my body looked different, she would just call it out. And I'd be like, it's not that serious. And she'd be like, yes, it is that serious. So now this is what we're going to do. This is going to be the follow up. And at the time, I'd be like, I hate coming to the doctor because she just is so on top of it. And then me realizing, Myra, how does that make any sense? Being that one, I couldn't get a Black doctor and she's
Right.
not Black, but she's doing all these extra steps to take care of me. Let me lean into this a little bit more. And I feel like it was such a big learning lesson of actually the things that she's highlighting are what all your doctors are supposed to do should you have another child. So
Right.
I appreciate what you pointed out.
Yeah, and for the most part, I mean, I too was that provider that is always running behind, but my patients always had grace for me because they knew
Mm,
that if she's running behind, she's in there counseling somebody through a miss,
yep.
and
Mm.
she's taking the
Mm,
if
mhm.
she's in there and she's taking more time with somebody potentially had a loss of some sort or is dealing or she's delivering some type of news or navigating some type of conversation that requires this additional time. And I know
Yes.
that when I get in there, I get the same care.
Yeah.
Yep.
And so for that, I received a lot of grace. Now, of course, my medical assistants and those that were working with me were like, "Don't you go in there and start scratching at the surface and start asking a whole bunch of questions." But that's who I am, right? I'm going to ask questions and I'm going to make sure that your questions are answered when you leave, right? And make sure that you feel good about your care.
That's quality care for sure. Yep.
Yes. Yeah. Um, as we were talking about the postpartum depression, in like previous days, it's making me think about definitely just about like the historical pieces, and then I'm thinking of even language and awareness, and having to be strong and not not wanting to say anything is wrong in general because so many other things are wrong. And it's making me think too about how, especially within Black women, stress, sleep disruption, and the previous trauma, how that interacts with the biology in postpartum depression. And so, can you speak to this, Dr. Karen, on like how these different things actually interact with our biology?
Right. So we know that once we have the baby, there's a huge decrease in hormones, right? So we know that there's a big drop off in estrogen, there's a drop off in progesterone, which then leads to a cascade of hormonal, emotional type of changes, right? And then also during the postpartum period, our circadian rhythm is completely thrown off, or how our sleep and
Mhm.
wake cycles would be because we've now got a baby. Right, that we've got to figure out their
Yep.
sleep schedule, right? And people say sleep when the baby sleeps, but it just that doesn't work, right? We know that that's really hard, and unless you have a village that's really present for you to help you, you're not getting adequate sleep. And inadequate sleep absolutely impacts our physiology, right? And the way that our nervous system is or is not regulated, right? So not having adequate sleep, these hormonal changes that also happen, and then if you throw in trauma on top of it, there is so much that's going on there that sets you up for a postpartum depression. Now, this could be a pre-existing trauma, right? That you're navigating, and that's one of the things that I'm getting at when I say, "Is there anything I need to know that would help me provide better care of you?" That includes a trauma history so that I can be trauma responsive. It's not enough just to be trauma informed, but to be trauma responsive. How am I responding to what you're telling me is your trauma? How am I holding space? How am I slowing down and listening? How am I taking a moment to really hear you? And then how are we gonna make a plan to navigate through that trauma? And for some individuals, that trauma can be a history of a loss. And so somebody has a history, let's say, of a miscarriage at 12 weeks or 15 weeks or whatever it may be. You best believe at that exact time, at that 12-week point, at that 15-week point, I'm checking in with them to see how they're doing because that trauma can show up, right? And then they're feeling even more anxious or maybe down or sad or depressed. So I want to watch their mood closely um, during those times, but throughout the entire pregnancy, actually. And then if we want to think about birth trauma, right? And birth trauma can show up in a lot of different ways.
Yeah.
Birth trauma can be not being listened to when you're in pain. You request an epidural, they tell you it's too late, you're too close, you can't get one or whatever. And now you're dealing with pain in a way that doesn't seem humane because you're not being listened to. Trauma could also be your blood pressure dropping. You got an epidural, now your blood pressure dropped. Now everybody's stressed about the blood pressure dropping. Now, uh-oh, the baby's heartbeat drops. Now everybody's worried about your blood pressure and the baby's heartbeat. And right, so that could
Oh,
be traumatic. Or trauma could be something like a shoulder dystocia. That's when the baby's shoulders get stuck, right? We worry about that. As a traumatic birth. A postpartum hemorrhage can be traumatic. So there are a lot of different things that can contribute to what somebody views as trauma for them. And so if we don't take the time to really debrief, what I do is I debrief right after the event. So I'm sitting there with you afterwards to make sure that we are having a conversation about how you're feeling. You may feel too overwhelmed to do too much in that moment. So postpartum day 1, I'm back in the morning. How we doing? Right? Checking in on you, talking about that trauma, but really thinking about how trauma, lack of sleep, and hormonal changes absolutely is linked to depression and the likelihood that you can develop a postpartum depression for sure.
wow. Thank you for breaking that down. I gotta fly to you for my next child,
I was
clearly.
just about to say, I don't have any children, but when I do, please let me in. Let me in.
I'm uprooting wherever you are at. I don't care how far you are. I'm there.
Me in and
Yes.
put me on the schedule.
Yeah, I mean, I count it a privilege to be there for birth. When I decided to go back, because I actually have a bachelor's in physics. I worked as a chemist for many, many years before deciding to become a nurse midwife. And when I thought about becoming a nurse midwife, I asked, what would I do in life for free? I'd be at a birth any day for free. Life
That's
just,
beautiful.
time just goes, you know what I mean? So what's going to be worth taking me away from my children and my husband, who I
Yeah.
adore, right? Being with somebody during labor and birth, although I don't do them anymore, I don't deliver anymore. But when I did deliver, it was justified because I really, truly just loved everything about being there with my patient, and hopefully seeing her to the outcome that she wanted to have, right? Because it's not necessarily about what I want, it's about what she wants within the limits of safety. So if you want to deliver on your hands and knees, we're delivering on hands and knees. Now, it's not the easiest for me, right? But it's not about me, it's about your birth experience.
Yes,
So,
totally. Dr. Ken, I'm curious, like when you think about like the nervous system when it comes to like mindfulness, specifically in the postpartum period, do you have any tips, any tricks, things that you can share with folks?
yeah, so we know for sure that mindfulness has been associated with decreased psychological distress, so decreased anxiety symptoms, decreased depressive symptoms, decreased stress, improved quality of life, improved well-being. It can even improve blood pressure. There's a mindful blood pressure program. So really thinking about how we can regulate that nervous system in the moment. And so, as I had mentioned to you at the beginning, I'm trained through Brown University's Mindfulness Center in mindfulness based stress reduction, developed by Dr. John Kabat Zinn. And the definition that he uses or that he has created for mindfulness is being present in this moment to whatever is arising and doing that without judgment, right? So, if we're able to slow down if I can get Black women to slow down, to shift from doing and going and going and going and shift into being, right? Now you're getting quieter and there's clarity in the quiet. So now as you're quieter, you're able to hear and notice more. Oh, I didn't feel the baby move. Oh, I do have a headache. Maybe I'm a little dehydrated. What did I drink today? I am feeling low back pain. Could that be contractions? I need to talk to somebody. I need to mention this to my healthcare provider. So do you see that as you quiet down, you're able to get more in tune with your own body, which you are already the expert in, but you're just quiet enough now to be able to realize, oh, this is what's going on for me. And that can be through doing a body scan. That could be at night, a lot of women talk about not being able to fall asleep. Doing a body scan is a beautiful way to help you kind of quiet down and fall asleep. Doing a sitting meditation is another beautiful way of just getting quiet in the moment. Mindful walking, noticing how you're moving, noticing how the body moves, differences in one side versus the next. Mindful eating, slowing
Yeah.
down, looking at the colors on your plate, noticing textures, noticing how you enjoy the food, right? So all of those things are different mindful ways of engaging in practices that can get us to slow down, that can regulate the nervous system, where you're able to achieve calm. With mindfulness, we're not striving to achieve these particular states, but often you can achieve calm when you engage in a mindfulness practice like one of the ones I just mentioned, or peace, or joy, or happiness, right? Or clarity, right? You might have so many things going on in your mind from competing demands of the day that you can't figure out what you need to be doing next. But if you can get quiet,
Oh,
that clarity will absolutely come.
wow. I love that. And we're trying something new, y'all. So before Dr. Karen gives us our takeaways, usually we shift into takeaways at the end. I want to make space for Donika and I to have a bit of reflection. Anything that's standing out for us or that's coming up for us. Oh, Donika, you want me to go first? So face was like, I got a million things.
I do. I mean, immediately, even just right now, you was like, "Calm down." Like, it was just so quiet just now, and that even just felt peaceful, like,
Yes.
just in this moment. And Myra and I, we're both licensed marriage and family therapists, and so we do have tools and we use it, but I think you have such a presence about yourself that feels very compassionate, and I can just like, you just feel caring, and you don't know us, you don't know anything about us, and it just feels so genuine, and it just feels so good to, like, see this from, like, another human person, especially a Black woman. It just feels so
Yes.
good right now, so, I mean, I have a lot to say, but Myra, what you feeling?
Feeling like this is good prep for my next child. Like the things that Dr. Karen was like highlighting about ways to be mindful are things that I'm a therapist, yes, and I could run down all the things for my clients, but I don't do any of those things in full transparency. But for me, as of lately, now that I'm back in therapy, Dr. Karen named all the things I'm literally highlighting to my therapist that I'm doing. I'm doing the mindfulness walks, I'm doing mindful eating. But I say that to say, with prep for my next child, these are things I want to continue to do so that way when the child does come, they're second nature things. They're not things that I'm running to like I did this time around. Like I ran to do these things because I'm like, this is a weird transition of life. What am I doing? Whereas now this conversation was confirmation that hold on to those things, stick with them despite if I'm postpartum or not, because they're super important. And just hearing you say it, it was almost like my subconscious brain was just talking to me. That's why I was just eating it up because I'm like, wow, this feels like the voice in the back of my head that's reminding me to do the good things for myself. So I appreciated that.
Yeah. Yeah, that's beautiful. And the other thing, I've had some clients where I've recorded meditations for them during labor.
Mm,
And especially for Black and brown communities that are really nervous or anxious, they have found that to be really helpful. And one of my clients was able to labor at home until she was 8 centimeters with her first baby, just listening to the recording that I had recorded for her. And the other listened to the recording in labor and delivery, and had an completely unmedicated labor and birth. And the nurses afterwards were like, what were you doing? Like, what were you listening to in your AirPods? Because it looked like you were meditating or something." And she was like, "I was, I was." And
That's
it
beautiful.
wasn't a long it wasn't a long recording that I had done for her. I think it was maybe 5 or 10 minutes to take her through 1 or 2 contractions, but
Mm,
how to signal to those around her that a contraction was starting,
yes.
and that when that contraction starts, unless you absolutely have to, or I'm requesting it, don't touch me, right? So don't take my blood pressure, don't stick a thermometer in my mouth, don't do, you know what I mean? Like, so she would do a signaling breath that would let the room know a contraction was starting without her having to even say it. And then she would get through the contraction, and then she would do another signaling breath for them to know that they could resume whatever they needed to resume. But it's really beautiful to see what can happen when we're staying in the present moment, and we're not worrying about the next contraction, and we're not worrying about the last contraction, and but we're just staying in this present moment. And I often say a moment you'll never experience again, right?
Yeah, you never
So
get
just
present.
be in this moment. Yeah.
Mhm.
Yes. Well, thank you so much. Something we do at the end is we do a takeaway for our listeners. This could be something that they leave with, especially something in practice, like something that right now folks are listening like, "Yep, you know what? Imma try that."
Something for folks to take away. I mean, I think the biggest thing for me is for them to know that they deserve being listened to, that they deserve to be valued, seen, and heard. That's the 3 things that I always talk about. I want people to feel seen, valued, heard. Um, and that if you're not getting that with your current healthcare provider, go somewhere else. It's okay. It really is okay. I think it's time out for us to be okay with mediocrity, that we're just okay with mediocre care. Like, "Oh, this is just who is available to me." If it is at all possible for you to be able to continue to look for someone that is compatible with you for your prenatal care so that you can have those optimal outcomes towards your postpartum care, right? I think that is super important. And so what I would want people to know is that you have options, that your care matters, that you should absolutely be listened to. We only need to look at the news, guys, in the last week or two, seeing Black women not being listened to, turned away, having babies in their cars, having their babies at home, whatever it may be, knowing that we deserve better. We should get better. And so, wanting us to think about how we can advocate for ourselves. If it's not us, family members advocating for us. If it's not our family members, doulas advocating for us. If it's not your doula, your nurse midwife, but whoever it might be, um, just recognizing that we all deserve optimal care. And the other thing that I would say is, in general, mental health should be something that you have to opt out of. Mental health should be part of the standard of care. So really providing mental health services at a 2-week postpartum visit across the different trimesters, having some type of check-in with a mental health care provider, regardless of how they screen, right? It should be the standard of care, and that you opt out if you don't need it, rather than us trying to find care for people. Do you understand what I'm saying there? So an opt out. Everybody gets it unless they opt out of it. That's another little nugget that I would love to see happen, and I think, us moving towards would be really great, and knowing that both of you are licensed therapists, hey, why not start with you?
Hey. Wow, that's powerful. Oh my goodness. Absolutely. A standard of care. You should have to opt out of it. Wow. Yeah. What would the world be like if that was a thing? Um, well, thank you so much, Dr. Karen. Thank you all for listening. We hope that you enjoyed this episode as much as we have. This has been amazing, absolutely amazing. And this is a great episode. I feel like, at least for myself, to end the year. You're our last episode of the year, and this is like the universe being like, "Yes, y'all, keep
Yes.
going, keep going." You feel it, Myra?
Yes. Wait, Donika, well, I have to shout out, if you're in LA, Kindred Space LA, they do like group counseling. They have a nurse midwifery and doula services all lumped in together. So I have to shout them out. They have amazing reviews. I have friends who have utilized them. Please check them out if you are in LA.
And I have to talk about the study.
Yeah, we skipped it.
Please let me talk about this study, y'all. So really quickly, I'm part of a study at UNC Chapel Hills with colleagues in the School of Medicine and the Department of Psychiatry, and we're looking at postpartum depression. And we're really interested in the genetics of postpartum depression. And so really thinking about the biology behind the postpartum depression, kind of what you were talking about, Donika. So we know that there's a component of genetics to postpartum depression. Like if my mom had a history of depression, it's likely that I could have a history of depression, right? Or if my sister has a history of depression, I might also have a history of depression as well. So the thing is, we don't know much about the genetics of postpartum depression in Black and Brown communities. A lot of what we know is based on individuals of European ancestry. So this particular study, while we're interested in all folks being part of the study, we're really interested in Black and Brown women being in it. And the only criteria is that you have to have had a baby. So you could be a grandmother, but if you had a baby, you could be in the study, right? So you go to momgenestudy.org, and that's where you can get information about it. And it involves a questionnaire and a blood sample, and you get reimbursed for your time and for the blood sample as well. So, and we fiercely protect your information and your data and all of that, because I know that's a question that Black folks are going to have. What you going to do with all my information? So I want to be upfront about that we are strictly held to protocols to protect your information and your data, but would love for you all to think about joining the study at momgenestudy.org. Okay, very good. Thank you.
Thank you all. This has been another episode of Black Women Healing Podcast. We will see you all next Monday.
It's your favorite co-host, Donika and Myra, and we appreciate you all for listening to Black Women Healing Podcast.
If you like what you just heard, go ahead and like, comment, and subscribe on all of our platforms, which can be found in the show notes.
We appreciate every type of engagement as it creates more exposure and helps our community get this healing on the daily.
See y'all next Monday. And don't forget, we are healing on
On the
the
daily.
daily.